A lot of you may have heard the terminology turkey neck. So what is it and what we can do to treat it? Turkey neck is basically a terminology used when we have a lot of flab in this under chin area. It may be due to aging or it may also be due to genetics. So a lot of factors contribute to this appearance. Now the appearance of this excess skin or flab or saggy skin often gives us a more aged look and we feel that the face is not looking that sharp. So what we can do to make our faces look sharper and how we can treat the turkey neck is what this video is about. Now, when we look at the jawline, so the jawline is an area which actually separates the cheek and the neck area. In the people who have turkey necks, basically what we see is a continuation of the cheek into the neck. That means there is no definition of the jawline. So more jawline definition is what we would need to create a look that is young and get rid of the excess flab and the excess skin. When we talk about the younger patients who have a lot of fullness in this area, they many a times think that it is all fat. But the reality is that a lot of things are happening around this area and it is not only fat. So when they opt for a procedure like a chin liposuction, they may actually feel disappointed after getting a chin lipo because it does not solve their problem. So what really solves the problem? Let us just break this into two parts, the treatment of the jawline and the treatment of this under chin area. When we look at the younger patients, if they have a smaller chin or a less defined jawline and the area around this is not very flabby, then a jawline augmentation with chin implant or a genioplasty and augmentation of the angle of the mandible will also give a good jawline definition without resorting to a lift procedure in the neck. So that is for the younger patients. Now let us imagine another scenario where the jawline definition is adequate but the lower part of the neck is full. We have to see whether it is fat or whether it is the tissue that is lax over here. If it is fat, to some extent liposuction will give us the result. But if the double chin area skin is also lax, then we need a lift procedure to adjust all that skin. Many times patients will come to me and ask that, doctor, is there a non-invasive solution to this? Well, honestly, for a long term, there isn't. But if you want to delay your surgery, then you can opt for some fat dissolving injections in this area, some chin filler to augment your chin, jawline fillers to augment your jawline, and at the same time, thread lifts to take care of some excess skin adjustment that might occur after these procedures are done. Now, when we talk about surgical options, which are really long-term or permanent, then we can get away with incision only around this area, which will help us deal with the excess skin over here, the muscle tightening, the deep fat removal from this part, and at the same time we can place a chin implant for the chin from here. So basically just one single incision to tackle your retruded chin, your lax muscles and the excess of fat in the deep part over here. And often the liposuction in this region, if we resort to it alone, it fails because this fat, what we are seeing over here as fullness, is not really superficial that can be removed with liposuction, but really a deep fat which is actually existing underneath the muscles. So we really need to open up this muscle and take out the fat from underneath so that we can plicate the muscles tightly from here and we can get that 90-degree angle that we so desire in patients of turkey necks. When we talk about older population, the scene is a little different because here we are also dealing with a lot of skin excess, and that can be dealt with an incision around here like in the younger population where we take care of the muscle tightening and the fat removal from the deeper part. At the same time, we also should approach the skin from here so that it can be tightened and all the skin can be taken at the back of the ear and adjusted. And that is how you can get a sharper defined jawline and less amount of loose skin and less flab over here, thereby giving you the defined look that you want. So all in all, when we talk about turkey necks, it's not just a unidimensional problem. We have to diagnose what is the fullness that is there underneath your chin. Is it skin? Is it lax muscle? Is it deep fat? Is it superficial fat? Is it the lack of jawline definition? So what it really is, and I can tell you for sure that in the correct diagnosis is the correct treatment dependent. And I can tell you with experience that when you diagnose properly, then you can treat properly. Otherwise, we keep trying multiple things and it does not give us the desired result. So make sure that when you are out to treat your turkey neck, you visit the right person to diagnose the problem and treat it correctly. So if you or somebody you know is suffering with this turkey neck problem, then drop me comments in the comment box below saying #turkey neck and my team will be very happy to help you. If you found this video useful, do share it with your friends and like the video. Thank you for watching.